How does body fat content affect toxicant accumulation and clearance? Animals with high body fat tend to store lipophilic toxicants like organochlorines, ivermectin, and bromadiolone for extended periods. For instance, a well-fed dog exposed to a lipophilic toxin may not show symptoms immediately, but when fat is metabolized during fasting or illness, the toxin re-enters circulation, causing delayed toxicity. In contrast, lean animals may experience quicker onset of symptoms but faster clearance. What are the clinical implications of a long biological half-life? A long half-life indicates that a toxicant stays in the body for a prolonged time, increasing the risk of accumulation and chronic toxicity. For example, cadmium has a half-life of 10–30 years in human kidneys and is similar in livestock. In veterinary practice, long half-life compounds require longer withdrawal times and ongoing monitoring. It also affects how long supportive treatment, for example, fluids or chelation, must continue. How does species-specific behavior affect exposure and absorption? Grazing, grooming, burrowing, or aquatic behaviors influence how different species get exposed to toxicants. Cattle may ingest large volumes of contaminated water or forage. Cats are at risk due to grooming after dermal pesticide application. Reptiles basking on pesticide-sprayed surfaces may absorb toxins through the skin. These behavioral differences directly impact the absorption phase of toxicokinetics. What is the impact of ion trapping in toxicology? Ion trapping occurs when a toxicant becomes ionized in a compartment and cannot cross back through membranes. For example, weak bases like amphetamines become trapped in the acidic environment of the stomach. Alkalinizing urine, for example, with sodium bicarbonate, can help eliminate acidic toxicants like salicylates by enhancing ion trapping in renal tubules, thereby accelerating excretion. This principle is often used in decontamination protocols. Why is urine pH manipulation used in detoxification? Altering urine pH can enhance renal elimination of certain toxicants. Acidic urine promotes excretion of basic drugs, like amphetamines, while alkaline urine promotes excretion of acidic drugs, like phenobarbital or aspirin. For instance, in canine salicylate poisoning, sodium bicarbonate is administered to raise urinary pH and accelerate excretion, an approach known as forced alkaline diuresis. How can toxicokinetics aid in forensic veterinary investigations? By analyzing plasma levels, tissue distribution, and timing of clinical signs, toxicokinetics can help reconstruct exposure timelines and identify causes of death. For example, if a horse shows signs of decameral toxicity days after eating moldy hay, toxicokinetic modeling can confirm delayed onset consistent with exposure. This can support legal claims or help track feed contamination sources. How do toxicants cross the blood-testis barrier and what are the risks? Similar to the BBB, the blood-testis barrier restricts many substances, but lipophilic toxicants and those using active transporters can still enter. Examples include cadmium and certain pesticides, which disrupt spermatogenesis and fertility. Understanding testicular toxicokinetics is important in breeding animals, where reproductive health is economically significant and may affect future generations. What are depot injections and how do they affect toxicant kinetics? Depot injections, for example, long-acting antibiotics or hormonal implants, release active substances slowly from the injection site, prolonging absorption. This creates a sustained release effect, often resembling flip-flop kinetics. For instance, oxytetracycline LA maintains therapeutic plasma levels for 4 days in cattle. However, overdose or repeated use may lead to accumulation, prolonged residues, and extended withdrawal periods. What is volume of distribution used for an overdose management? VD helps predict how widely a toxin has spread and whether blood-based detox methods, like dialysis, will be effective. For toxins with low VD, for example, ethylene glycol, dialysis is efficient because most of the compound is in the plasma. In contrast, drugs with high VD, for example, digoxin, are extensively distributed in tissues, making dialysis less effective. Knowing VD guides the choice of treatment. Why do neonates have higher toxicant susceptibility? Neonates have underdeveloped detox systems. Immature liver enzymes, reduced renal filtration, and permeable barriers, for example, BBB. For instance, enrofloxacin can cause cartilage damage in growing puppies, and ivermectin crosses the immature BBB in neonates, causing neurotoxicity. Additionally, nursing neonates may ingest toxicants excreted in milk, requiring careful attention to lactational transfer and maternal treatments.